Milrinone, aka Primacor. Depending on where you work, you may see it all the time or you may have never seen or heard of it. So let's talk about this drug a little bit. My name is Leah. I've been a CVS nurse for 18 years, and we're going through a series about common drips that you see in an ICU setting. And so today we're going to be focusing on Primacor and Milrinone, aka Milrinone, and just kind of chatting through some things that you see and some things that you should know as a nurse at the bedside taking care of a patient on this medication. So Milrinone is an inotrope. That's what we love about it. And it also is going to cause vasodilation, the blood pressure vessels to open up and get wider. In a patient that's already hypotensive, this could be a really bad thing, right? And so this patient, I would really love to have hemodynamic monitoring on. I would love to see that patient's SVR and cardiac output before I started this drug and right when I started this drug, so I could be following up to say, like, is this helping? Is it too much? Is it too little? Is the increase in pressure need possibly worth the cardiac output increase that we're seeing here at the bedside? And we can communicate with our cardiologist, physician, or whoever's at home helping us manage these patients. So when we are caring for a patient, if we start Primacor on that patient, we want to be really monitoring their hemodynamics. We're going to be watching for that drop in blood pressure. We do know that these drugs, all inotropes, really have a risk of arrhythmias, and so we're watching for arrhythmias and we're ready to treat them if they pop up. But in a patient with decompensated heart failure, this may be exactly the drug that they need, especially if you've already tried dobutamine and they weren't really responsive to that, or they had some reactions to that, and you still need that cardiac output to increase, but you're, for different reasons, unable to put in an impeller or other type of device. This may be what you need to try next. So that's Primacor. The most common dose that you're probably going to see Primacor at, of course, it's facility dependent, is 0.125 mics per kilo per minute. And then you titrate up by that amount, like by 0.125 each time. And we're titrating it up for cardiac output as long as our patient's blood pressure can tolerate it and their MAP stays within normal limits. So continue to follow this series. We're going to be talking about some other drugs in the ICU setting. Comment to me. Tell me what you're seeing. Like, are you using Primacor still? Is it still commonly used in your facility? Do you like it? Do you not like it? How do you compare it personally with dobutamine? I would love to hear your experiences. Share this video with a friend.